Hello, my name is Dr. Michael Murphy, and I'm the Medical Director for Center for Emotional Wellness, True Health. We have a number of locations serving adolescents and young adults. We have realized in the course of developing our treatment program that many young adults and adolescents are struggling with isolation. Isolation has distinct impacts on your brain and on the chemistry of your brain, and can lead to significant levels of anxiety and depression. During the pandemic that we've all experienced, levels of isolation have increased significantly. As we come out of the pandemic, we are finding that adolescents and young adults are craving connection with each other. Most of the time, young adults, especially if they're experiencing anxiety or depression, are isolated and focused on their technology, cell phones and Instagram and so on and so forth. The program that we have is called an intensive outpatient program. What that essentially means is that Monday through Friday for 3 hours a day, you will be getting intensive individual and group therapy to address your needs. We treat patients who have trauma, anxiety, depression, sometimes suicidal thoughts. If you're contemplating doing treatment with us, don't be afraid that you have to suddenly join the group and speak about everything that's going on with you. It's not that way. You would join the group and you could spend time listening and taking in what's happening. And when you're comfortable and ready, you can speak your truth. We will work to address whatever needs you present to us in the treatment. It's important to realize that this kind of intensive therapy can make significant changes in your life and in your well-being, and even in the chemistry of your brain, much like antidepressants do. In addition to my oversight of the program, we have a child and adolescent as well as adult psychiatrist who will see you while you are in treatment at the program. She will make sure that you are diagnosed properly and that you have any medication that you need to facilitate your participation. Our program also has a psychiatrist who follows you while you are in the treatment. In addition to the group program, which is the main part of the program, we have individual therapy. So there are times when there are things that you want to talk about just one-on-one with a therapist, and we create a space for that. In addition, very often people are struggling with family issues, and so we have family counseling available as well. So if you're ready to investigate starting treatment with us, the first step is to come in for an initial evaluation with one of our therapists. This would be free of charge and would be a comprehensive assessment of your current situation. We would interview you, and if you wish, interview relevant family members, and come to a conclusion by the end of the visit as to whether you would benefit from the treatment, and we could begin a treatment plan.